There are several different lines of evidence and hypotheses that are starting to drive those sort of considerations. The most obvious one being PD-L1 immunohistochemistry. Obviously in melanoma, the drugs have been approved without the requirement of doing PD-L1 immunohistochemistry. And actually that's been the case in most cancers. And the rationale for that is that even in patients who are, quote, negative, the drugs still work better than the other drugs that we have. And so that doesn't really help us yet. But there are several other sort of translational analyses that are coming towards prime time that might get us closer to that answer. On the basic biology side, we observed that gene expression profiling, knowing which genes out of all the genes that we have expressed, which are up and which are down, can really strongly stratify patients. And we believe it will be very soon that gene expression profiling analyses will be available for melanoma to help answer this question. Other groups have looked at other things like the mutational load in the cancer. So some groups have found that if tumors have a very high mutational rate, the likelihood of response is very high. That hasn't quite come forward yet, but with next generation sequencing in clinic, we're starting to be able to pick out which patients those might be. Another group has looked at specifically in the tumor microenvironment which T cells have shown signs of being in the tumor microenvironment and inhibited but ready to go with expression of CTLA-4 and PD-1. And that approach also is a little more nuanced, but again has been able to pick out patients very clearly who are going to benefit. So the long and the short is we're still not quite there, and we're doing this empirically in clinic, but I think it's not going to be very long, 6 months, a year, a short period of time before we really do have sort of that next generation of immunotherapy diagnostics, really let us hone in on each individual patient and say monotherapy, combination, which combination, so on and so forth.